This is video podcast 21 from learningradiology.com. Video flashcards, most commons in chest imaging. Hello, I'm William Herring from Albert Einstein Medical Center in Philadelphia with a bit of a cold. The way this works is that the first side of the card will have a question. For example, in what direction would you travel to get to the North Pole? You can pause your player while you think of the answer. The second side of the card has the answer, in this case, north. You can use this as either a video only, or an audio only, or a combination. What is the most common type of bronchogenic carcinoma to cavitate? Squamous cell carcinoma. What is the most common location of bully in alpha-1 antitrypsin deficiency? The lower lobes. What is the most common benign extrapleural mass? A lipoma. What is the most common location of cysts in eosinophilic granuloma? The upper lobes of the lungs. What is the most common histology in Hodgkin's disease of the lung and mediastinum? Nodular sclerosing Hodgkin disease. What is the most common bacterial infection to occur in alveolar proteinosis? Nocardia asteroides. What is the most common location of rounded atelectasis? The posterior segments of the lower lobes. What is the most common primary lung tumor under the age of 16? A bronchial adenoma. What is the most common benign lung tumor? A hamartoma. What is the most common cause of superior vena cava syndrome? The cell type. Small cell carcinoma. What is the most common form of emphysema? Centrilobular emphysema. What is the most common cause of respiratory distress in full-term infants? Meconium aspiration syndrome. What is the most common anterior mediastinal mass? A thymoma. What is the most common cause of a gram-positive pneumonia? Pneumococcal pneumonia. What is the most common lung manifestation of blunt trauma? A pulmonary contusion. What is the most common thoracic manifestation of blunt trauma? Simple rib fractures. What is the most common cause of bronchopneumonia? Staphylococcal pneumonia. What is the most common pulmonary finding in lupus? A pleural effusion. What is the most common primary mediastinal malignant germ cell neoplasm? A seminoma. What is the most common manifestation of rheumatoid lung in the thorax? A pleural effusion. What is the most common cause of hemorrhagic metastases to the lung? Choriocarcinoma or angiosarcoma. What are the most common origins of an endobronchial metastasis? Breast, kidney, and colon primaries. What is the most common bronchogenic carcinoma in which atelectasis is the only finding? A squamous cell carcinoma. What is the most common segment and lobe for a pulmonary sequestration? the posterior basal segment of the left lower lobe? What is the most common lung and lobe involved in congenital lobar emphysema? The left upper lobe. What is the most common form of congenital cystic adenomatoid malformation? Type 1, with single or multiple large cysts. What is the most common lung location for metastatic calcification in renal disease? The upper lobes. What is the most common primary chest wall malignancy? Achondrosarcoma. What is the most common radiographic manifestation of Wegener's granulomatosis? Pulmonary nodules. What is the most common cause of a pneumothorax? Trauma. What are the most common ribs to fracture? Ribs 4 through 9.